In this practical video, we will mainly discuss about the superficial reflexes. So what are superficial reflexes? So these are mainly the motor response that we get after scratching the skin. So these reflexes, these are mainly graded as either present or absent. Although if there is asymmetrical responses, it should be considered as abnormal. So for the superficial reflexes, the examples are plantar reflex, abdominal reflex, cremasteric reflex, bulbocavernous reflex, and anal reflex. So in this video, I will mainly discuss about the plantar reflex and abdominal reflex. So basically these two reflexes are mainly examined if the person is having any abnormalities. So let us see what are plantar and abdominal reflexes and its procedures. So for the plantar reflex and abdominal reflexes, we need the instrument for the measurement. So instrument, it is mainly the hammer. So you already know about hammer and its uses. In the hammer, you can see after opening the hammer, the lower part, you can see the blunt sharp part. So with the help of the sharp part, we will examine for the plantar reflex and abdominal reflexes. So first let us discuss about the plantar reflex. The nerve root, it is S1. So the procedure for elicitation is the patient will be in supine, legs lying straight and in relaxed position. So with the help of the sharp end of the hammer, slightly scratch the lateral border of the sole. So for the response, there will be two responses. One, it is the flexor response and another is the extensor response. So flexor response, all the toes will be in flexion. Then next, for the extensor response, the patient should be in supine lying, legs lying straight and in relaxed position. With the sharp end of the hammer, slightly scratch the lateral border of the sole. So mainly the procedure is same, but the response for the extensor, it will be the small toes are fanning, ankle and big toes in dorsiflexion. So in the diagram you can see for the flexor response and for the extensor response. First diagram, it is mainly the flexor response. All the toes will be in flexion. And the second diagram, the extensor response. The small toes, it will be in fanning and the big toe in dorsiflexion. Then next let us discuss about the abdominal reflexes. So the nerve flow, that is T6 to T12. Procedure for elicitation is the patient in supine lying and in relaxed position. Then slightly scratch the abdomen with the blunt object in the medial direction across the upper and lower quadrant of the abdomen. So we will get the response as homolateral contraction of the abdominal muscles. So this is the basic procedure for performing the abdominal reflex. So this diagram you can see the direction for performing the abdominal reflex for both upper and lower quadrant. So basically from outside to inside you will elicit for the reflex response and the direction it is given. So basically this is a diagonal pattern for the abdominal reflex. Thank you.